My name is Cindy Borden, and I'm the Director of Training and Technical Assistance for the National Coalition for Homeless Veterans, where it is our mission to end veteran homelessness. Join us here each week as we use an equity lens to explore how specific demographic characteristics impact an individual's ability to access safe and affordable housing.
We want to take this time to acknowledge and thank the Home Depot Foundation for sponsoring this podcast and for continuing to fund veterans housing throughout the country. For roughly a decade, the Home Depot Foundation has remained committed to supporting the mission and work of NCHV. Their continued partnership means more housing availability for veterans and hopefully one day an end to veteran homelessness. The Home Depot Foundation works to improve the homes and lives of U.S. veterans, train skilled tradespeople to fill the labor gap, and support communities impacted by natural disasters. The Foundation's Veteran Housing Grants Program awards grants to nonprofit organizations for the new construction or rehabilitation of permanent supportive housing for veterans. Since 2011, the Foundation has invested more than $375 million in veteran causes and improved more than 50,000 veteran homes and facilities. The Foundation has pledged to invest $500 million in veteran causes by 2025 and $50 million in training the next generation of skilled tradespeople through the Path to Pro program. We'll be highlighting some of their work as we talk about various affordable housing developments throughout this series. If you're developing projects that support veterans exiting homelessness or would like to learn more about how the Home Depot Foundation is making a difference and continues to serve those who serve, visit homedepotfoundation.org.
Welcome back to the Road Home Podcast. According to the Center for Disease Control and Prevention, approximately 1 in 4 adults in the United States has a disability. Despite the passage of the Americans with Disabilities Act over 30 years ago, disabled Americans face higher rates of poverty, housing instability, and food insecurity, and lower wages than their non-disabled counterparts. In today's conversation, we focus on housing for disabled people. We'll begin with Dara Baldwin from the Center for Disability Rights. Dara will give us a framework for the discussion, providing historical context and practical insights. She'll also challenge us to rethink our language, assumptions, and actions as we work to create accessible, affordable housing. In the second half of the episode, we'll hear from 2 different agencies that develop and provide housing, including projects designed for people with disabilities. Milo Peinemann from American Family Housing and Susan Michael from New Directions for Veterans will share their agency's strategies for successfully working with households with a disabled family member. We have a lot to cover today, so let's get started. Welcome back to the Road Home Podcast. Today, our guest is Dara Baldwin from the Center for Disability Rights. Dara, welcome to the Road Home.
Thank you. Thank you very much. Happy New Year to everyone. Thank you.
And Dara, can you take a minute to introduce the Center for Disability Rights and what the organization does and also what your role is?
Sure. My name is Dara Baldwin. I am the Director of National Policy for the Center for Disability Rights. The Center for Disability Rights is what is considered a CIL, a CIL, which is a Center for Independent Living. Those are federally mandated through the Rehab Act, and they must have at least one in every state. There are, of course, many in every state. My CIL, Center for Disability Rights, is headquartered in Rochester, New York. And CILs are non-residential centers where people with disabilities go for services, for fellowship, for advocacy. There's a 5-prong group of things that we have to do, and one of them is advocacy. So I have a counterpart who does state work in New York, in Albany, and my boss wanted a presence in what is considered a DC block way. And so I have been doing our national policy for this is my 5th year right now. This month, I started January 2019.
Great. So before we get into talking about some of the barriers that people with disabilities face when they're trying to access safe and affordable housing, I think it's important that we have a kind of a mutual understanding or a foundation of what and who we're really talking about. So can you define for me, what is a disability?
Yeah, sure. Very good question. So in 1990, when the Americans Disabilities Act was passed, there was a definition of disabilities, but it was narrowed. And let's remember what was happening in the late 80s, right? You had Jesse Helms and still had homophobia going on. You still have it now, but at the time, HIV, AIDS, and they didn't want those things included. So as we have a 3-branch government, they passed a law. Then there were several court cases that said, no, this definition is too narrow. The Supreme Court took a case and sent it back to Congress and said, you need to expand this definition of disability. So that's why you have the ADAA, which is the Amendments Act, which happened in 2008. And that expanded the definition of disability. And this is our layman's way of explaining it. A disability is anything that hinders your everyday life. So if you can't sit, you can't stand, you can't swallow, you can't see, you can't hear, if you have mental health issues and concerns, all of those things are considered disabilities. People with disabilities are people with disabilities. There's nothing wrong with the word disabilities, and there's nothing wrong with having a disability. And that's where I come from in our work. I do disability justice work, which centers BIPOC disabled folks. And we come from that space of having pride in having a disability. So also there are disabilities that are not seen. And so there is no, what does a person with a disability look like? Because you don't know. And there are people who have what's called episodic disabilities, where they may be living their normal life. And as I was saying, it doesn't hinder their everyday life, but then they get in an episode where it does. People who have like MS, multiple sclerosis. If you all watched West Wing, kind of what the president there had, Martin Sheen, when the show first came on, no one knew. In the middle, he had MS. Towards the end, there were days where he couldn't write, he couldn't speak, he couldn't see. So people have episodic disabilities, which are caused by many different things. And so there is no, what does a person with a disability look like? And let's not forget our children. Many people leave out our youth in this. And so having a disability, using the term and the word disability should not trigger anyone and should not be overlooked or try to use other terms. Unfortunately, in housing, people use special needs. There is no law that protects special needs. So we try to tell people don't use terms that are not protected. People try to, I don't want to say that word disability. That's fine. If you don't want to use the word, personally have a disability, I can't tell someone how to identify themselves, but I can tell people who are trying to advocate and who are trying to make things better, you must use those terms, because that is what is in the law and that is what's going to help this community.
So a couple of things that stood out to me there is that, one, we don't know who we're talking about necessarily when we say people with disabilities, because it could be anyone and everyone, because not all disabilities are seen, but also the importance of using the term disability for someone who is trying to advocate for this group, and not worrying about, oh, that term might be offensive because legally that's the term that we need to use.
So 2 things. One is, I'm going to keep pushing back. People with disabilities are people. So it isn't that we don't know what that's it. That's the problem. People are trying to make it different. No, you can't tell someone's Black, right? Or I'm Black. You can look at me and say I'm Black. That's not what we do. The other thing is, it's not just the fact that the term disability is the legal term. There is nothing wrong with the word. Disabled people have pride in what I say them, because I'm not a person with a disability, and I say yet, because more than likely in my life I will be. But that is the problem with trying to confine and define and what does this word mean and should I use it, is ridiculous for this word. Disabilities, it's Americans with Disabilities Act. We are working with people who are disabled to find themselves that way. Not all of them, but the majority of them do. And so it's just like, LGBTQ, for years, no one wanted to use queer. And now all of a sudden queer is the word. So that the terminology and the stuff is not important. What is important is understanding and knowing what this community needs.
Great. Thank you so much. I really appreciate that clarification. So where do veterans fit into this conversation?
Sure. So veterans, it is unfortunate for veterans that many of them get disabilities, because I'm not saying it's horrible to get it, but that happens at a higher rate for veterans. A couple of things. One, many people don't understand the actual definition of a disabled vet. So, and I had to take I'm a lifetime learner, and working with groups like PVA, Paralyzed Veterans for America, DVA, I took my classes from them and learned the definition of what a disabled vet is and how many different types of disabled vets there are. So, right, most people look at veterans who go over to war and get a disability. Yes, that's a disabled vet. But there are people who never leave the United States and never go into war and work on a base and get a disability. You know, a truck runs over them while they're working, or unfortunately, what happened in Texas when they had the shooting, many of those victims who live are now disabled vets, right? So you can be a vet. So the definition of being a disabled vet varies so much in the veterans community. So it's very interesting there. I also, not just say veterans, but let's say military, because you also have military families, right? Their spouses, whether it be, you know, their wife or their husband or their partner, if they're LGBTQ, and their children. We do a lot of work, right? There's a separate, completely different education system for military family children. There's a separate, completely different program for housing for military families, so veterans. And that's part of our veterans disability work. And I've worked in both areas for the same 20 years that I've been doing housing and the same almost 12 years that I've been doing disabilities. So that's one thing. And then the other thing I'll say, and this is not the veterans' fault, but also I work in Congress, I work on the Hill, right? Talking to staffers, talking to members of Congress. And it is unfortunate that many people on the Hill, and actually around town, around DC, will define disabilities that way and cause a friction and cause harm in how we increase and make better policy, and also how we treat disabled people. And so let me explain this. I have talked to members of Congress and had them say, well, how did this person become disabled? And I'm like, does it matter? They're a disabled person. And if I say it's the veterans who are having a problem, they get more concerned because it's considered an honor, like, oh, they got their disability because they were serving their country. Whereas someone who was born with a disability is considered a burden on the system. Now, I say this so that people can understand, especially when it comes to housing and how we have little better policy and laws for veterans housing than we do for people who are getting Section 811, or how we get the funding for Section 811, which are either get an onset of a disability or born with a disability, and not a veteran, and the money I'll get for veterans and how they're so excited. Okay, we'll help out over here with veterans, but we got a little problem with right onset and people who are born with disabilities. Now, let me be very clear. That is very much in the policy side. That is not in the activism side or in the advocacy side. And I'm glad to say that our veterans that I work with, the groups that I work with, never do that. And we'll push back on that when they are talking to people and say, listen, I got my disability serving my country, but I'm disabled, and my person over here, my brother, my family who got an onset of a disability deserve the same things that I do. And so I just want to put that forward and how this looks to our country and how this looks in our work of advocacy, and specifically around housing, and having the terms of people always are looking for affordable housing. We have our own AA. We want accessible, affordable housing, and accessible comes first, because in this country, we only have 4% of the stock in this country is accessible. And we are at 32 years since the ADA was passed. That is absolutely ridiculous.
Wow, that's a stunning statistic. So I want to get into that a little bit more, but first, you alluded to this a little bit with some of the challenges you see in the policymaking sphere, but and this could be a whole episode. So I'm going to ask you to just sort of kind of briefly describe what are some of the misconceptions or myths or stereotypes that are out there about people with disabilities, whether it's a disability they were born with, whether it's an episodic disability or something that was onset from something else. What are some of those myths and stereotypes?
Yeah, so there's, we have a number of them, but I'll go with the first ones, is that they can't live on their own. We believe all disabled people, no matter what their disability, should be live on their own. They just need the services. They just need the support. We all need support. So they need, there are some people who are completely paralyzed, may not be non-communicable, all those things. They need what's called personal assistance. So people don't think that disabled people can live on their own. That's not true. The second is when it comes to supportive housing, it is unfortunate that supportive housing is usually one bedroom. And in this country, if you have children, you cannot live in a 1-bedroom according to the government and in government housing entities. You need 2 bedrooms. Children need to have their own bedroom because of all the things out there that have happened to children. But it is not believed that disabled people have children or have relationships or have sex to have those children. So all the permanent supportive housing in this country is 1 bedroom. So these people have to choose between their family and themselves for the housing. A third one that's really a stickler for us is the fact that because you don't think that people with disabilities also want to be in the community. So when they create community things, those are not for them, meaning there's not a playground in the country at a public housing facility that's accessible for our children to play with. They're building these exercise centers and places of health and pathways to go walking. They're not accessible. They don't think our people need to roll and be outside and get nature and exercise as well. Or they'll have events and they won't have ASL interpreters and they won't have people there. They won't put things in large print. They won't include disabled people in any of those things, aerobics classes. They don't think disabled people can run those things.
So thanks, Dara. So you mentioned a couple of different things there that were stereotypes, but also barriers to people with disabilities being able to find that accessible, affordable housing. Can you talk a little bit more about some of those other barriers that people find? You mentioned the statistics about the housing stock that is accessible. What are some of the other barriers that people with disabilities face?
Sure. So there are also people, like I was talking about before, who don't think people with disabilities can live on their own or should live on their own. So this is where, right, seeing that person's disability and looking at that person and not thinking that they are capable of keeping a home clean or are capable of getting in and out of a house in case of an emergency, a fire. And so then people think they're an insurance risk or a risk. People have barriers where, unfortunately, if we do have people who are couples and you have 2 disabled people trying to live in the house together, there's all kinds of things, and especially for our people with mental health diagnoses. If it's known, some states you do have to reveal you have a mental health diagnosis, and people don't want, quote unquote, the crazy people. That's why that term is offensive when we tell people to stop using the word crazy as an adjective, because it's offensive. It's offensive in the work of helping people with mental health. Use your vocabulary, right? And if it's out of control, say out of control. Like what's happening right now in Congress. Oh, this is so crazy. And we're like, no, it's out of control and it's harmful. Because people have these concepts of people with mental health diagnoses as being violent. That's the other thing, is mental health people are not violent. So those concepts around that, or if they have a disability that, like HIV and AIDS, that can, coming in contact with someone and if they can get the disease. And we're like, no, that's not how you get HIV and AIDS. People don't understand these things. Anything they think is contagious. They don't want that person living in their facilities, in their places of whatever their homes that they're putting together. We also have barriers where people have come up with solutions to housing that don't include disabled people, such as tiny homes. I've traveled the country. I've seen over 55 different tiny home programs. Not one of them had accessible housing or accessible processes, like setting up a bathroom system, a shower system on the outside of a tiny, like setting up a community and having the bathroom outside of the house or any of that kind of stuff. Those things are not, first of all, part of housing justice or housing equity, because it's not including disabled people. So most of the time when people come up with housing solutions, they are not thinking about disabled people, and it is not for our community. And so those are the barriers that I see and I've seen over the years, and they continue to grow, which is harmful to this work.
So to dig into that a little bit, what are some of the things that we can do to address these barriers? One thing that comes to mind based on what you were just saying is education and helping people understand more. But in addition to that, what are some of the things that we can do to make sure that as we move forward, people with disabilities are considered and their needs are considered as we create these housing solutions?
So another great question. And you said education and stuff. And it's not just that simple, because in this case, it has to be those people who are trained and specifically know about disabilities, educating people. So as we always say, and especially now you're talking about veterans, you need to have those, right? Those closest to the solution are closest to the problems. So all of these committees, please start hiring, right? Disabled vets, right? Hiring disabled people to be on your committee, to be a part of your staff, to work there consistently, and not just for that one project. We tell people all the time, when you're getting together and you're going to start creating something, and in the room, if you don't have a disabled person in the room, if you don't have an LGBTQ person, if you don't have a formerly incarcerated, a person who's a refugee or immigrant in the room, your program is going to be wrong. And if if you don't have multiple different people from the suburbs, from the city, all of those things, that's what we tell you. So don't have disabled people on there as a token and say, oh, we had this person on this committee, and then get rid of them. They should be woven within the work you're going to do, the fabric of everything you're going to do for the next 10 to 20 to 30 to 50 years. And in fact, letting go of that control and giving it to those people is the best way. And then, of course, I have to push forward the SILs. If you go to our website, the ILRU, you will find your SIL in your state. Like I said, there's multiple ones. So you look at your zip code and you find it. And the SILs are there for this. We provide those services. SIL staffers have to be, 51% have to be disabled. And so they're there to help you out. We have testers who will come and test out your program in wheelchairs and walkers and say, yeah, this is accessible, this isn't accessible. And just being able to set up a meeting and have a conversation with disabled people, that only comes from people who have the profession of setting up an accessible meeting. So that's what we say. You need to hire and keep on people who are disabled and know these systems and will do this work, not only because they have to for themselves, but because it's something that's good for the community, and it is woven within the word equity. That is equity.
Great, thank you so much. So a lot of the folks listening to this podcast are either housing developers or people who provide housing services, right? Provide housing, whether it's permanent supportive housing or transitional housing. What is the most important thing that they need to know to better meet the housing needs of people with disabilities?
Mm-hmm. I would have to say they need to know that they don't know accessible housing. And we need to, as a country, come to that realization. And they also need to know that it is imperative to include disabled people in that process, and that most of the people that they are placing in housing right now, if you want them to stay there and age there and be there for years, which is what we want, right? We want to end homelessness, or excuse me, people being unhoused, right? See, it's a new language. Then we're going to have to start thinking about creating accessible facilities, accessible housing, and what that looks like for the country. That 4% stock, which was done in 2011, I could send you the link to the report. They're redoing it right now. They're doing assessment now. Hopefully that number goes up. Should be 40%, should be 50% in this country. At some point, almost all of us are going to need accessible housing. It is much easier on our bodies, and it's much more helpful. But that's what people, I feel that your group and the people you're talking about need to get out and talk to disabled people and see where disabled people are living now, and see the great examples out there as well, where we do have really good, accessible, affordable housing.
And so you may have already answered this in what you were just saying about getting out there and talking to people and making sure that disabled people are integrated and leading the way and making these decisions moving forward. What do you think the biggest mistake is right now that policymakers or, people trying to serve this population are making?
I think it goes back to your first question, is the inference that disability is offensive. being afraid to talk about disability, being afraid to talk to disabled people, not wanting to be in the same space with them. It's offensive. I've seen it. I've heard it. I've heard the conversations about them. It's just as offensive as me being a Black person. And again, intersectionality, BIPOC, Black people, brown people are disabled. You name a group, they're disabled, right? Like we said, the veterans, people who are refugees and immigrants, formerly incarcerated, LGBTQ, all of that work has to include disabilities and disabled people. And I noticed that a lot. You don't see a lot of the people you're talking about coming to our conferences, attending disability conferences to find out and learn about what disabilities are. But you surely see us trying to go to your conferences to make sure we're talking to housing authorities, to public housing officials, to those who are providing housing. I'm a board member of the National Low Income Housing Coalition, and we have plenty of disabled people who come to those conferences, but I rarely see housing people going to our conferences and interacting with our people.
So that's really, I think you've given us a charge collectively of things that we can do. Is there anything else, Dara, that you would like to share with us about what an individual person can do within the system, or to change the system moving forward to make housing that is accessible, safe, and affordable more available for people with disabilities?
Yeah, sure. So yeah, I gave you a charge again. And going to those conferences is not just going, also, right, putting an RFP in to have a panel discussion, have a focus group there, and have conversations there, and do it annually, or do it every 2 years, or do it every 5 years. Also joining us in our letters and our asks of Congress and policy making, what we're doing. There's also ways like this, if you're having a podcast, if you're having conversations, a series of trainings, one of them should be on disabilities and should be done by disabled experts. If you're having conversations with your elected officials, making sure whatever policy briefs, whatever information and packet you hand into them or give to them for their research includes a professional and expert writing about accessible housing. Whenever you write letters, stop just saying, or whenever you are talking about affordable housing, please use the term AA, accessible affordable housing. I've been pushing this here in DC, it's working, but you should never be talking about affordable housing without talking about accessible housing, because 90-something%, especially of veterans who are unhoused, are disabled, and you could get them all the housing you want, but if it's not accessible, they're not going to stay. They're not going to be healthy. They're not going to be good in those homes. So all of those things, changing the atmosphere and the concept of ending homelessness has to include incorporating and infusing accessibility and disabled people.
Well, thank you so much, Dara. I appreciate your time today. We'll look forward to future partnerships. And again, thank you for your time. We appreciate it.
Thank you so much. And thank you everyone for the work you all do every day. We all make a change when we get up in the morning and say we're going to make a difference. So thank you.
Thank you, Dara, for sharing your insights and pushing us to learn and grow. Now let's look at how to implement some of these ideas while providing housing and services. First, we'll hear from Milo at American Family Housing, followed immediately by Susan from New Directions for Veterans. Let's hear what they have to say. And we know that among families who are experiencing homelessness, they're about 2 times more likely to have that household member who has a disability. So how does having that family member with a disability, how does it affect the household's ability to access the housing and maintain that over time?
If you're looking at an individual who's struggling with housing, with their challenges, and they're in crisis, you're dealing with an individual. You check on them. If their behavior and their neighbor is fine, if their neighbors aren't bothered, you have a lot of room to work with, and you do your wellness checks, and you case conference on how to approach it on a practical level, and think about the best way to engage over time. And on some level, time is on your side, as long as you're kind of thinking about the critical risks and their individual history. When you're working with someone who has kids, well, that's a different story. you've got to think about it differently and more immediately. And that's a different type of engagement and a different pattern of work by the staff. So at a basic level, it's time, it's quality time. You've got to have a caseload that allows you to focus and customize your approach. We all talk about individual service plans or housing plans, customized approaches that evolve over time. And that's a different type of thing when you've really got 3 people in the household. And sometimes the person that really needs your support isn't the one that is the qualifying member of the household. And so, I think that's really what's so different there. And so when you're looking at a head of household who's in crisis, who's struggling, they really have to be working with us for us to support the whole household. And I think for our profile, with the way we operate as a housing provider, we don't really do street outreach. We don't really do much in the way of shelters, except for a couple bridge housing programs. You're really looking at households coming to us that are already engaging with services enough to get into housing and get supported. I think and looking to maybe re-engage and reunify their households with their children and loved ones. And so we tend to have that as a starting point for a lot of what we do. But yeah, so it's a different dynamic, and I think for us, we make sure we have 2-bedroom units and larger 1-bedrooms in all of our developments, so we have place for families to go. It's interesting. We operate in 2 counties. One county, Orange County, it's all 2 bedrooms. It's very hard to find studio units. Very hard to help individuals. In LA County, it's the way around. It's all a single and 1 bedroom. So it's very hard to house families. So we have a very strange kind of bifurcation there. That's just we've inherited. And so, in that context, you can be tempting in Orange County to put families into any old building, which usually works. It works well, but you have to be mindful that there's a reason why we have project-based housing, where we can have staff on site and we can support our very highest need households. And I'm just very excited to see how much housing is getting built right now. There has been a transformative change in the consensus conversation at a local level, and so the chance to bring in more deed-restricted family units that we can control and support in the way we have with office on site it's a huge opportunity for us.
And Milo, are there differences in the sort of services provided, or some of the things we talked about earlier, the community building spaces and activities for families when they have a household member who has a disability, whether it's an adult or perhaps a child, or even a parent that's in that household that has that disability? Are there different kinds of services or different ways that you approach working with that family than maybe a family who does not have that need?
Yeah, I mean, among the factors there, supporting them with childcare resources and helping the child get to after school activities and support, getting them to school, getting them to aftercare programs. What are ways to support getting nutrition into the household? This goes back to our we call our children's program, where we build in a lot of social activities, so we can create a space where the children have tutoring Tuesdays and the monthly get-togethers, where that's 5 or 6 times a month, where they're getting together outside the household. And that means our staff knows what's going on. They know where the child's at. They have a different awareness, so that it's not just about to always be framing every conversation as you have a disability, we're here to help you. It's very stigmatizing. It's very exhausting that you have to go to CES and you have to just tell someone doing a vulnerability index what your disability is. It's exhausting to have that constantly happening all the time. It's not really the best way to do it. How can you get into those households and support those families without having constantly framed about how you need help, you have a disability? Well, hey, great news. Instead of having a front door valet concierge service like Luxury Housing has, we have these fantastic child-oriented programs with piano lessons and computers and so forth and so on. And so that's how we really kind of tackle it. And in that context, we have to be prepared to call Child Protective Services or something as well, if that's the case. This is our staff's mandate.
I want to switch gears just a minute to talk a little bit about veterans with disabilities, but specifically about, I know some of New Direction's developments are actually focused on veteran families where somebody in the family has a disability. And so I'm curious of what that looks like in terms of either the units themselves or the buildings themselves, the communities themselves. Are those different when you're targeting a family who has a family member who has a disability, and also what the services look like. So both from a physical building community perspective, but also a service provision perspective.
Yeah, the configuration of those units, one that I'm thinking of in particular in our Placentia Veterans Village, they, for the ADA units, there are often, bottom floor, there are wider doorways, lower sinks and cabinets and things like that for accessibility. Oftentimes there's another room for a care provider. If there, is a family, then it would be obviously a larger unit, because family isn't always the care person, right? So in terms of services, I really think that it's just much about the coordination of care and being able to have, releases to speak to providers, making sure that, they can get to all their appointments. We have an ADA van at our Placentia site for that reason. So wheelchair, fits in the back, and they can get to their appointments. Yeah, it's just really being thoughtful, I think, about and trying to predict what they may need, and what differences they need, but also, keeping in mind like the commonalities as well.
That's great. So being flexible to address different needs, but also
Yeah.
not focusing exclusively on the differences, and making sure that it's part of it, that everybody's part of that larger community.
Yes.
Thank you, Dara, Milo, and Susan, for sharing your expertise. Before we conclude today's episode, I'd like to highlight a few key ideas. First, we need to change the way we think and talk about housing. If we want people to stay and thrive in housing, any conversation about ending homelessness must focus on accessibility as well as affordability. Second, while education and myth busting can help address the stereotypes of disabled people, to make real progress, we need to make sure people with disabilities are woven into the fabric of future policy and program decisions. Finally, we need a holistic approach to housing and supportive services that recognizes an important truth. People with disabilities are people that want to be both independent and part of their community. You can learn more about the topics we discussed in this episode by checking out the weekly one-pager, which will include links to the Center for Disability Rights, American Family Housing, and New Directions for Veterans.